Morning, guys. My name is Hectoria with Wells Financial Coaching. Thank you for stopping by. This channel is focused on financial literacy. I help coach people. I help them make a plan for their money so that their money can work for them instead of the other way around. So I help people get out of debt. I help you focus on the next step if you are out of debt and how you can maximize the income that you make. So if this is something you're interested in, go ahead and hit up my website and schedule a free call. I would love to talk to you and see how I can be of help to you. But this video today is focused on side hustles that nurses can do. I'm biased because I am a nurse. So I just felt like this is an area that makes more sense to me because I know the area, and I feel like when you are budgeting and trying to get out of debt, there's only so many areas you can cut. Okay? Once you've done all the fluff and you're down to the meat and the nitty gritty of your budget, you need to add on more income. So a side hustle is a great way to add more money onto what you're currently making. So if you are interested, even if you're not a nurse, this is still information that maybe you could share with someone. So first thing on my list, if you are an RN or an LPN, is to join a travel agency. Hands down, the best money maker out there right now. I mean, these travel agencies, I get text messages, especially when COVID, like we're in the midst of it, they were offering $10,000 a week, okay? And now that things are calming down a little bit, they're still offering what, 2, 3, 4 grand a week, depending on where you travel with. So if you are in a position to travel, that is the best option for you right now. My second suggestion is to sign up for the COVID vaccine centers, okay? Those, again, it might be through an agency, but they are offering nurses anywhere from $35 to $50 an hour. And depending on the shift you work, I'm sure there's differentials, but that is something I would do if I were in a position right now and I wanted to make money quick. I would definitely do a COVID vaccine center. Third on my list is home health nursing. Now, back in the day, I did home health when I was getting married and we were trying to, ramp up some cash. And let me tell you, honestly, it was the easiest job I had. Now, regulations have changed. And depending on the type of home health you do, you may be more detailed, it may require a little more, but there are some home health agencies, all you have to do is go in, assess medications, make sure their patients are compliant. If they have any issues, document that, lay eyes on the patient. But it definitely pays. And what I love about home health, right, is the flexibility of it. So you can keep your daytime job and still pick up a home health agency and work like on the weekends or whatever shift you want. Right, so the next side hustle I want to talk about is to become a CPR or BLS, ACLS instructor. Now that is more, you have to get certified through the American Heart Organization. But once you have your certification, you kind of have your own business. So you make your own schedules, you work when you want to, you are able to purchase these items. I think even Amazon has like the mannequins you can use, and you can certify nurses and LPNs. And this is, again, you can do this from the basement of your home. It's that flexible. You make your own hours and you just make sure that you are actually training the people, because there are some CPR instructors that just want the money, which I don't advocate for, because the whole purpose of this is to save lives. So if you're a CPR instructor and you're just signing certifications over, shame on you. But if you want to actually do this as a profession, you can. It's a nice side hustle. You don't need any overhead costs. Do it from your home and make some money. So the last hustle I want to talk about is to become a clinical instructor. Okay? Those instructors work a set amount of time, and it's usually 1 day a week. So just think about when you did your clinicals, you went out 1 or 2 days a week. You were there for maybe an hour to 2-3 hours, and then you had an instructor. And the instructor is there to, teach you about what you're going to see today and kind of walk you through those scenarios and to talk about those patients so you can gain your experience. So that is one field that does pay. The beauty about nursing is the flexibility. It's not so much that we make, great money, because I can think of other fields that, they really make money. But I love nursing because it's so flexible. It is. You can stay with your 312s, or if your finances demand a little more out of you, your financial situation, you can pick up shifts. Okay? So I hope you are, doing whatever it feels right for you and your family during this time. Like I said, I do appreciate all the nurses that are at the bedside, and even the ones that are not, the ones that are keeping patients from getting to the bedside. I do appreciate all nurses out there, and thank you so much for watching. I will catch you guys in my next video.